You missed some important news from the LGBTQ+ community this week. To ensure you are current, we are recapping that important news. Here's what you may have missed.
We queer up health. CDC warns about bacterial infection rising among gay men.
The CDC issuing a warning about a rise in a highly drug-resistant stomach bug. Elena Athens joins us live now with more on the story. Elena?
Yeah, good afternoon to you, John. The North Carolina Department of Health and Human Services say that they haven't seen any of these cases just yet in our state. However, they are expecting them to start popping up because of how transmissible this infection and the bacteria itself is. So the drug-resistant bacteria is called Shigella. There are limited antimicrobial treatments available for these particular strains, and it is easily transmissible. It can spread through things like person-to-person contact or contaminated food or water. An infectious disease expert says medical professionals classically see these cases in daycare centers or group settings, such as nursing homes, but now the number overall of cases are rising.
One of those organisms that what we call is invasive, so it invades the surface of the intestines, and so it's not uncommon to see blood in the stool with that, with Shigella. Abdominal pain, high fevers, people can get quite sick from it.
So that doctor says the best way to protect yourself is overall good hygiene, washing your hands, making sure your food is refrigerated right away here if you're in the States. However, he says if you are traveling overseas, perhaps to a less developed country, opt for bottled water and food that has been cooked thoroughly. We're live in Raleigh. Elena Athens, ABC 11 Eyewitness News.
The Centers for Disease Control has issued a warning to healthcare providers about a rise in antibiotic-resistant shigellosis, a condition overrepresented among gay, bisexual, and other men who have sex with men, as well as people living with HIV. The bacterial infection, shigellosis, affects the digestive tract and usually causes inflammatory diarrhea that can be bloody. The infection may also lead to fever, abdominal cramping, and tenesmus, a continual or recurrent urge to evacuate the bowels. According to the CDC, Shigella bacteria are transmitted by the fecal-oral route, directly through person-to-person contact, including sexual contact, and indirectly through contaminated food, water, and other ingested materials.
Keep watching the only television news in the world from our LGBTQ+ community and stay informed on everything that is important for and about our diverse LGBTQ+ community.